So this was my first experience ever with an AmeriCorps student. I didn't really know much about it. Tommy was great to have around. He really embraced it and embraced the work that we're doing.
Working with him was really interesting. I think he came in with a really open perspective. He kind of jumped right in and he would just do his thing, and he was just really wonderful.
So HealthNet's mission is to serve individuals regardless of the ability to pay. One branch of HealthNet is the Homeless Initiative Program, which is who we are all working for. A lot of the patients that we see have had maybe past trauma or just have not been treated well by your traditional medicine. And so they are not comfortable going into what you would think of as a traditional clinic. And so we go to the patients and see them in their comfort zones.
So every day I would go in Monday through Thursday. We'd go do street medicine. So it was a mix of acute and chronic medical and psychiatric care, housing, transportation, insurance, medication. It was really the whole spectrum of these things that people need, but maybe they don't know how to navigate. Street medicine, it's definitely an emerging branch of medicine that instead of putting the responsibility of healthcare onto people experiencing homelessness, we bring the care directly to them. Something that you run into with nonprofits is that a lot of times they are grant funded or their operations are kind of limited, and you're really working on getting to that place of sustainability. And so for my nonprofit specifically, they needed research. They needed ways to show other community partners that the work they're doing matters, that it's impactful, and that it's deserving of support.
One thing that is always a struggle is there's a constant need for completing program assessments, collecting data, analyzing data so you can give it for both grant reports, but also future funders or grant applications. And ultimately, at the end of the day, you're just trying to keep the lights on.
What I was looking at was, how is this street medicine program that's only been around for two and a half years, how has that impacted the unhoused community and their usage of emergency departments? Because that's like the primary access point for people who maybe don't have a primary care doctor or don't have insurance.
It was just really also great to have him be able to take some of the work that we're doing and be able to do research on it and actually put it into a format that's able to show the impact that we're making on the community.
For me, it gave me hope that there are going to be really good doctors out there who are willing to learn, willing to listen, as well as just serve populations that traditionally go unnoticed. And I think for HealthNet, it was good to, as well, to kind of build that morale to see that there are going to be really good, helpful people coming up through this, and Tommy's going to be one of them.
With our medical students, a lot of them already have a background in research, and we support them throughout the research process. So they're able to build capacity for a nonprofit around anything related to like evaluation and research, whether it's looking at best practices or whether it's, interviewing their clients to collect some qualitative feedback. One thing that they also do and bring to the relationship is just kind of building that bridge between the medical community and the community that they're serving alongside with.
I've always been interested in service and trying to find opportunities to give back to the community, especially wanting to be a physician in the future. I've always thought, I want to know the needs of the community so that I can better serve them. And I felt that HPHC was the perfect platform to do that. At Exodus, they're a resettlement agency, so they essentially take refugees from all over the world, and they take you from that point of coming into the country that first day all the way to self-sufficiency. My job was to help with the healthcare side of things, be their health advocate. I would go to a lot of these appointments and I would hear the doctor is looking at their watch. They're saying, I have 15 minutes left and I need to get out of here, so you have to take this antibiotic. I'd see that disconnect in various forms, and I'd be a little frustrated, why aren't we all talking to each other? Why don't we have that communication flowing? And so that's why I decided to look into it a little bit further. While it can be a little frustrating to think about how we only have a finite time with the patient, our impact can go much larger than that. I would say always look deeper into the patient and their needs, and then know the resources available in the community, because there's a plethora and a lot of them go unused and aren't really well represented in mainstream media or whatever else. So making sure that you can connect the two so that you can better serve the patients in the long run.
I think what makes HPHC special is that in medical education, we talk a lot about healthcare disparities, but I feel like we're actually doing something about it. We are training our students not just about the topic in terms of research, in terms of education, but they are out there in the community, getting the work done, building those relationships that are necessary. And that to me is something that I wish all medical schools had an opportunity for.
Our first year with having someone was last year. It is absolutely amazing. Casey had been a volunteer with us before, so she already kind of knew what she was getting into. She was able to pick up all the specific things that she needed to do outside of what she normally did as a volunteer. She was able to cover shifts when we had volunteers call in. There were some shifts for the entire summer where she was the only one that was working. So it was a huge asset to our organization. And because of our volunteers and the different ways that they come to us, that's the only way that we are able to actually run as an organization.
I wanted to do something over the summer that had a greater ability to have an effect. Lab-based work can sometimes take years and years to, come to its fruition. So I wanted to do something that could help the community that I was in the short term, and then obviously eventually for the long term, but something that could have an effect.
It's not just the day-to-day, having someone there, having them do this project, and having them introduce new things, but it's also this great opportunity to have a massive volunteer day and actually get physical stuff done that we need as well. If you are a student and you're thinking about this program, do it. At the end of all of it, we only have each other. We only have our community. And by becoming a member of this program, you will have like a foot in the door automatically. And you will have a sense of community that you wouldn't have had before. And you'll also be helping out a nonprofit who most likely their whole drive is to make the community better as well.